Administering ophthalmic medications. Ophthalmic drug administration is the administration of a drug to the eyes, most typically as an eye drop formulations. The purpose: eye drops may be instilled to treat a number of eye disorders or to anesthetize an eye before treatment. Indication: this medication is used to treat eye infections, and for the contraindications, allergies to the medications. For the special considerations, infants, children, immobilize the arms and head of the children to prevent accidental injury due to sudden movement during the procedure. And use the doll to demonstrate the procedure to facilitate cooperation and decrease anxiety, and explain the technique to the parents of an infant or child. An IV bag and tubing may be used to deliver irrigating fluid to the eye. And for the equipment needed, clean gloves, sterile absorbent sponges soaked in sterile normal saline, medication, sterile eye dressing pad as necessary, and paper eye tape to secure it. And for the irrigation, add irrigation solution, irrigating syringe or tubing, dry sterile absorbent sponges, moisture-resistant towel, and basin.
Good morning, ma'am.
Check the medication card against the original physician's order to avoid medication error. Identify the client by letting the conscious client say his full name and verify by looking at the client's wristband and which has his name and hospital ID number written on it. Bring the medication to the client bedside. Provide privacy and explain the procedure to the patient. Wash hands. Assist client to comfortable position, either sitting or lying down.
Lingkod lang, ma'am.
Don gloves. Then cleanse the eyelids and eyelashes of any drainage with a washcloth. Moisten with normal saline solution from the inner to the outer canthus. Use each area of the washcloth only once to prevent the breeze to be carried into the eye when the conjunctival sac is exposed. Give the client a dry sterile absorbent sponge. Tilt the client's head back slightly. The head may be turned to the affected side. Remove the cap from the medication bottle, being careful to not touch the inner side of the cup. Discard the first bead drop of medication to prevent solution or tear from flowing towards the other eye. Invert the monodrip plastic container that is commonly used to instill eye drops. Instruct the client to look up while focusing on something on the ceiling. Place the thumb or two fingers near the margin of the lower eyelid, immediately below the eyelashes, and exert pressure downward over the bony prominence of the cheek to expose inner surface of lid and cul-de-sac. And for the eye drops, hold the dropper close to the eye, approaching from the side, but avoid touching the eyelids or lashes. Squeeze the container and allow the prescribed number of drops to fall into the outer third of the lower conjunctival sac. Hold the dropper 1 to 2 cm above the sac. And for the eye ointment, hold the tube above the lower conjunctival sac. Squeeze 2 cm of ointment from the tube into the lower conjunctival sac from the inner canthus outward. For the irrigation variation, place the absorbent pads under the head, neck, and shoulders. Position the curved basin at the cheek on the side of the affected eye. If the client is sitting up, ask him to hold the basin to avoid spillage and the solution flowing to the bed. Then expose the lower conjunctival sac or to irrigate in stages. First, hold the lower lid down, then hold the upper lid up. Exert pressure on the bony of the cheekbone and beneath the eyebrow when holding the eyelids to appropriately expose the site. Next is to fill and hold the eye irrigator and 1 inch from the eye. Next is to irrigate the eye, directing the solution into the lower conjunctival sac and from the inner to outer canthus to make sure that the flow of medicine is from the inner to outer. And And the last is to irrigate until the solution leaving the eye is clear. No discharge present or until all the solution has been used. Instruct the client close and move the eye periodically. Closing and moving the eye allow medicines to distribute over the eye. Clean and dry the eyelids as necessary. Wipe the eyelids gently from the inner to outer canthus to prevent possible skin irritation. Next is to apply an eye pad if needed and secure it with paper tape and instruct client not to rub the affected eye to promote comfort to the patient. Remove gloves and perform hand hygiene. Dispose all supplies appropriately, then assess the client's response right after the installation or irrigation. Proper documentation can be the basis of the next procedure, then chart the medication administered.